Okay, so tell me about this book because I haven't had a chance to read it yet. So tell me about it in a nutshell.
In a nutshell, Trauma in the 12 Steps is a way to help addiction counselors better understand trauma knowledge and implement it into addiction treatment. And it's also a way to help trauma counselors and mental health counselors better understand addiction.
Nice.
Because something I found in my world was that a lot of mental health trauma people had this attitude, but if I just help them resolve the trauma, the addiction will go away. And a lot of addiction people would say things coming into settings like, but you're not here to deal with your trauma, you're here to deal with your addiction.
Right.
And I really saw that there was a gap in between the trauma knowledge and addiction knowledge. And there's so much talk going on nowadays about how we need to better integrate trauma into addiction. And what I've done in this book is to give clinicians just a really user-friendly way to do that. And I've done that by saying, there's nothing wrong with the 12 steps. There's nothing wrong with traditional recovery.
Right.
What it can fundamentally offer is great, but we can enhance what we do with it by being savvy to what people who have traumatic experience.
Okay, so you go through step by step with the 12 steps, or so how is the book set up?
How is it organized? In a very haphazard, not in a totally haphazard. That's a very good question. No, I don't do it step by step.
I wondered about that.
Yeah. What I essentially do is I start with the basics. Like, here's the problem. Here's the solution I'm proposing. Here's a crash course on trauma. Here's what the 12 steps offer that can help with trauma. For example, I talk about like acceptance principles that they're way in and how that could be a phenomenal help with trauma.
Right.
This whole idea of telling the story, sharing your story like it leads can be a phenomenal help. And that's what 12 steps offer that can be trauma sensitive. Then in the next chapter, I get into what some of the problems are with 12-step recovery with trauma. For example, some of the slogans that can be pejorative or problematic, how certain dictatorial sponsorship styles, treatment center mentalities can really do more harm than good. And then the rest of the book is talking about virtually solutions in terms of here's how you can help people work their 12-step program in trauma sensitive. An example, I would be talking to professionals about getting to know the meeting culture in your community.
Okay.
If you're in recovery, that might be easier, but what I would even say to non-recovery professionals is get to know where some of the meetings are so that you can say that this meeting is known for being open minded and tolerant.
Right.
And then at that point of the book is where I get into some of the problems with language and how those language issues can be addressed in a sensitive way. And I think a theme that brings through that solution part of the book is how it's handled.
Right.
For example, the phrase character defects can be phenomenal.
Right.
But if you put that in context for a person instead of them just hearing that out of context, or hearing the word powerless out of context. So the rest of the book talks about solutions.
Okay.
And then we go into, for example, the stage-wise treatment explanation, which is something I'm actually going to pick your brain about for a while. Sure. And then I talk about other resources that are available. For example, I get into some of the practicals there about what most addiction counselors can do. For example, breath work, guided imagery strategies, getting a person working on exercise. And then I talk about other specialty things that are available that can be accessed, and here's how you can help people better access them. Okay. So, the first part of the book really, I like to think that there's solution-focused, real practical things you can do, strategies. And I do a lot of cases in there too. Okay. Composites of cases, stories of people I've met along the way. I tell some of my own story.
Okay. Neat.
So now I pick your brain because you were one of the first people when I was, really starting out in your trainings helped me realize this idea of stage-wise treatment.
Right.
And I talk about that as being a phenomenally trauma-sensitive approach.
Yes.
Because the heart of a trauma-sensitive addiction approach is you have to meet a person
where they're at.
Sure. So tell us where this term stage-wise treatment originated and how you worked it with your...
Sure. Stage-wise treatment, I guess you could say I learned it from a couple different places. The first one was Francesca Di Clemente's Stages of Change. So they talk about, not being ready for change and then starting to get ready, being ambivalent about change, and then preparing for change and then actually doing something about it. And then Miller and Rolnick took that to another level with motivational interviewing. So really, this stuff has been around for between 25 and 30 years, and It's just now that it is starting, thankfully, to get into the addiction field. So most of the way addiction treatment has been set up forever and ever is you have to be in the action stage, you have to be ready to do something with your life, whereas half of the people that are coming in through your door are pre-contemplative or contemplative. They're not ready for action. And so the stages of change helps you move them toward action in a way that isn't going to chase them out the door. That's basically it, in a nutshell. But it's been really helpful for me. I didn't learn about it until I was doing my addiction fellowship. So you have to realize, for the first 4 years of my training as a psychiatrist, I had no idea what it was. So it's been really helpful, and I try to teach about it, sort of whenever I can.
Sure, and as an addiction psychiatrist in the community, how would you say you put this stage-wise thinking into action?
I basically use it with all of my patients. I mean, it's what are you ready to do as opposed to what do I want you to do.
Right.
It's, so it is about the willingness. It's about if you're not ready to do this, then let's focus on something that you are ready to do. If you don't want to take this medicine, I'm not going to force you to take the medicine, because really, to me, the crux of it is motivational interviewing says, you're the boss that's in charge of your life. I'm only here as your guide. I can't make you do anything that you don't want to do. And that was so freeing for me as a therapist, but it's also helpful to people, because then it allows them to really think about their own life and the changes they want to make in their own life. I mean, I can scream at you till I'm blue in the face. If you don't want to quit using, you're not going to quit using. But I can also help you explore what would be good about using. Why might it be helpful to stop using? And that is a much more friendly approach that gets people thinking instead of sort of getting them shut down. That's the part where it helps.
Exactly, and that's what I explain in the book for both counselors and sponsors.
Yeah.
There is a component in here that's addressed to sponsors, that by forcing, you're going to shut people down, anyway.
Right.
But if there's unresolved trauma, that can be very triggering.
Even worse. Right.
Because so much of what traumatic experiences gave people was this idea of making them feel backed into a corner.
Yes.
Or pushed into a corner. Whereas another principle I put in here is that every time you have an opportunity to introduce choice, introduce it.
Yes, there always has to be a menu of options.
Even if it's as simple as, okay, we're going to work on some trauma processing strategies. Here's a few different things we could do.
Right.
Which sounds like it would be the best fit for you.
Mm-hmm. Exactly. So we could try. We could try this medicine, or we could try that medicine. Here's the pros and cons of each one. We could try no medicine.
Sure.
So it's the same thing. Choices.
So that's an example of, again, there's some philosophy, I guess you can say, I get into, some cheerleading people in the community, and both recovery treatment communities and 12-step communities, about, how offering choice is actually a very simple thing you can do with trauma. So I think what happens a lot is, at least in certain addiction professionals I've encountered, people hear about getting trauma and it's like, we don't want to destabilize them, or we don't want to get into too much too soon. And one thing I say is that doing something like stage-wise treatment is trauma sensitive.
Right.
Honoring the dignity of a person at all times when you
That's
trauma sensitive is trauma sensitive. Teaching breath work, helping a person notice their body cues and regulate, which is something you can do even if the person's still using.
Yes.
Is trauma sensitive.
Well, right. There's a difference between trauma sensitive and trauma services.
Well, sure.
And so that's what you're talking about.
Yeah, because what we're talking about with trauma services, that would be what we call trauma processing or reprocessing.
Yes, that's the actual work.
And again, there's a misconception. So many people would think of that as, well, that's trauma counseling. But one thing I impart in this book is that trauma counseling is the whole shebang. It's preparation.
Yeah, a lot of preparation.
It's introducing recovery in a way that is sensitive to the person who's been traumatized experiences.
Well, that's what I remember from when I went to your EMDR class. Was it seemed so strange to me, but really the first 6 weeks of it is just about preparation, making sure they're okay with everything, making sure they're not suicidal, making sure that the foundation has been laid, and then you get into the actual repetitive motion and the repeating of the story. And so it was demystifying. So that was good.
And so much of what I do in this book is to help people better lay that preparation.
Yeah.
And I do things like teaching breath strategies. I get into pressure point, progressive muscle relaxation work. Really, and even strategies for introducing exercise, helping people get into a yoga type program that regulating body level functions, because we tend to experience so much of that kicked up traumatic stress in the body,
Right.
is an important part of preparation.
Well, and it also reminds me of what we were talking about earlier with mindfulness. Mindfulness fits so nicely into both trauma work as well as addiction work. To me, it's beautiful. It's a nice overlap. So
That's what I try to do, help people see we have more in common, that the mental health world and trauma and addiction world
are not so different after all.
we have more in common than we may think.
Right. Yes, we like to think we're on different sides of this so-called fence, and we are not. So.